sharing my screen. All right, so you should be able to see my PowerPoint. If not, let me make sure I'm not muted. Okay. If not, let me know. So we'll post the slides and the video online and or email them to you within the next few days. If you're not school or health department employee, we'd ask you jump off the line now just so we reserve time for question and answers for those staff members. Hand any information on down through the line to those who need it. Just a reminder that this will be our last regularly scheduled meeting for this school year. If you have any questions or concerns that come up over the summer, please contact us. And as the school year approaches next year, if it looks like it'll be useful, we'll start meetings up again. And, you know, if you have any opinion on that, make sure and let us know and we'll do what we need to do. This information should have been emailed to you along with the information from last week's meeting, but I just wanted to make sure that you did get it. During the meeting last week, it was asked, there was a question about an email that MHSAA sent out about out of season summer workouts not needing to do the weekly testing. I did follow up with MDHHS, and the doc who's in charge of that program did confirm that MHSAA did ask them if that would be appropriate, and they did agree with it. So I just wanted to make sure you knew that any indoor or outdoor out of season summer workouts or summer conditioning that you're doing don't have to take part in the sports testing. So again, that email, I believe, went out last Thursday, likely to your athletic directors or whoever your MHSAA point of contact is. That second bullet was a copy and paste from that email. So again, I just wanted to follow up with you that I did confirm with MDHHS that that was approved. We're getting some questions on masking. I just wanted to go over the information we covered last week, and then some newer information that I think we can apply to summer school. So according to the state orders and MIOSHA rules, fully vaccinated individuals and employees don't have to wear a mask. Currently, though, the public health recommendation is through the remainder of this school year, which is pretty much done, but through the remainder of this school year, it is recommended that everyone in the school itself continue to wear a mask. And I put the references there. And that's mainly because most of your students are not vaccinated, and just logistically trying to change all your policies within a week or two and get verification of all your employee vaccination status, all of that would just be a logistical nightmare. So it was just recommended, finish out the school year fully masked. The CDC still has it listed in their operational guidance for schools that they will update their guidance in the coming weeks, mainly pertaining to next school year, not so much for summer school. But they did come out with guidance for summer camps. And in my opinion, if you guys have summer school programs, summer camp guidance could certainly go towards summer camp, or summer camp guidance could certainly go towards summer school programs. So what is copied and pasted here came right from the CDC website, but I put in green, you know, wording to convert this to school programming. So basically, camp programs, or in my opinion, summer school programs, should encourage people who are not fully vaccinated, or anyone who might need extra protection. So like if you have staff who might be on chemotherapy or things like that, to continue to wear masks indoors at all times. And then if outdoors and in a very crowded setting, or doing activities where you have very close interactions over a sustained period of time. And then camp programs or summer school programs should support campers. Okay, sorry, I thought I missed a spot there. I did cut some things out. I wanted to make sure I didn't cut out the important stuff. So it should be supportive of anyone who might be fully vaccinated but still wants to wear a mask for safety. You can also continue to just say everybody has to wear a mask regardless of whether you're vaccinated or not, just to make it easier on you. But the CDC is saying in camping programs, if someone is fully vaccinated, which again, remember is 2 or more weeks after the final dose in a vaccine series, whether it's 1 shot or 2 shots for that series, anyone who's fully vaccinated does not have to wear a mask. So again, if you have summer school programs or summer programs, you don't have to make people wear a mask. The main issues to consider is, if you have kids under 12 who have to wear masks indoors and you have adults who are not wearing masks, if you're having issues with compliance with your younger students, if you don't have to wear one, why do I have to wear one? That kind of thing. You may want to consider that. The word on the street is that after July 1st, all the EPI rules or most of the EPI rules would go away. So no one may have to wear a mask, but in terms of recommendations, likelihood is, depending on the prevalence of the illness in the area, anyone who's not vaccinated will likely still be encouraged to wear a mask indoors. So hopefully that makes some sense. So again, the recommendation is to just continue having everyone wear masks indoors through the end of the year, just because it's easier to do that. You have a lot of kids who aren't vaccinated, but over the summer, I'm fine if you want to follow the camp program guidelines. But again, you certainly can set your own rules and make things more, you can have more people wear masks than they have to. You just can't, we don't recommend you go less than is required or recommended. This was just this has really nothing specific to do with schools. It was just something we discussed a bit today on one of my calls. And just to educate as many people as we can, and just so you're aware of it, when we're just swamped with cases, we tend to do the best we can with contact tracing, but we know that we're really going to have to focus on like school-age kids or healthcare workers or nursing homes, things like that. And we're going to miss a lot of people, but we know that we're trying to stop a flood, with a Band-Aid, and we just do the best we can. As we get to this, hopefully continuing point where we have fewer and fewer cases, it actually gets much more important that we really aggressively contact trace every single case as best as we can, and really have people who need to be in quarantine be in quarantine. And that's because we want to stop this. We're getting to a point where we can find cases, we can find contacts, and if we can stop outbreaks from happening, that's how we're going to keep these cases really low. We run into resistance though, because we've been at a point where we weren't that aggressive for so long, and now we're saying, hey, things are so much better, but you have to stay home and you can't leave your house for 10 days, and people don't quite understand that. So again, just to try to make people understand a bit better why we get so much more aggressive with contact tracing and quarantine as we get fewer and fewer cases. It's so we can start really, after that flood, when we start getting that trickle, you can really dam it up and shore it up and, stop the flood and clean it up and fix it all. I put a link to an article there that was just published today. It's from ABC News, but it's just a good overview in more layman's terms as to why that is important, and just kind of going over what I just said. So again, we're not changing anything that you do or what we've recommended for schools, but again, just trying to educate more and more people about that. So we can kind of remind people how it was in the beginning when we were trying to stop every single case from spreading. So now to get to our data. Oops, sorry, I don't need to look at my kids. All right. So our numbers actually are pretty darn close to where we were back at our lowest point in February. So it's very exciting. Michigan, last week we were at 121 cases per million. We're at 71 these past 7 days on average. Our percent positivity is at 4.7. It was 6.1. The 6 counties of Central Michigan District Health Department is averaging 64 cases per million. Nobody's in triple digits, so that is very exciting. And our percent positivity is averaging at 4.9. And again, none of those are in double digits either. So I don't think that's happened in a really long time. Looking at District 10, their 10 counties are averaging 60.2 cases per million and 5.6% positivity. All of their percent positivities are below 10%. Newaygo County is the only one that's above 100, but still they're much lower than they have historically been. So things are definitely coming down. Mid-Michigan District Health Department is at 97.9 cases per million and 5.6% positivity. And again, their cases per million are coming down dramatically. Still some little hot spots here and there, but definitely improving. Looking at the state as a whole, sorry, this is really tiny print, but the percent positivity has gone down 25% in the last week. It was 20% the week before. It's decreased 73% since April 8th, and just been consistently going down. We now have the 7th highest number of cases in the state and the 12th highest case rate. So you can remember we have been #1 for quite some time. So we're finally, luckily, not the winners in that. It's not something we want to be winning at. Our outbreaks are decreasing. School outbreaks are decreasing. High schools are still the place where most outbreaks are occurring. And the highest number of clusters are in athletics. But still overall, we're seeing big decreases in all of those outbreaks and clusters. Hospitalizations and ICU stays are decreasing. We're 4th for inpatient utilization for beds and 3rd for ICU. And again, we're going down in our ranking in that as well. Our death rates are going down and our status in the country is going down in that too. So that's all really good. We have 4.2 million people that are fully vaccinated. We've given 8.7 million vaccines. So this is the percent positivity over the entire pandemic. You can see we're getting down close to where we were back at the low point in the, late winter. This is the cases per million. The top here is the last 3 months. The bottom is the entire pandemic. And in terms of cases, it looks as though we are below where we were as a state at the lowest point back in February. These are the age groups. They're really all starting to smush together here. The only thing that switched is the 80-year group just barely flipped above the 70 to 79-year-olds. But really, since everyone's coming down, they're all kind of smushing together here. So not as impressive as it has been. Again, our variants continue to climb. We're over 11,000 variants identified. Over 80% of our viruses that have been genotyped are a variant. Nationally, 69.7% are the B117. I'm sorry, 81.2% are specifically the B117 variant. So we're above the national average. If you remember, if you've been on these calls regularly, this little blue section here is the amount in the nation that is the normal or the wild type variants. This little blue part gets smaller and smaller every single week. So basically our normal variants now are the variants of concern. So it just is what it is. So this is the percent of people going to the ER specifically for COVID-like illness. It's down to 1.8%. It was really, really high, up and around 12%. So again, really, really dropped. And then our hospitalization trends has really, really dropped. And again, that's been, always the big concern is our hospital system's not able to keep up with this. So this is a great thing. The outbreaks, again, schools are the highest, just kind of has been the whole time, but that's who's reporting really well are schools and nursing homes. So, but they've decreased. So schools went down from 275 reported outbreaks to 217, and high schools, middle schools, and elementary schools all had a decrease in the number of outbreaks. We only had 2 new outbreaks in our districts, and last week we had 7 new outbreaks. We have had a big increase in our ongoing outbreaks, but they've all kind of shifted from new outbreaks to ongoing. So if you remember, you have to go 28 days without any new cases before you drop off that ongoing outbreak list. So, but the good thing is that we've had very few new outbreaks. Our testing turnaround time in the state has stayed stable. It's very good. So people needing tests can get them and can get them resulted very quickly. Just a reminder again, it's our last meeting, and this slide is on the last slide of every presentation. It has my email and cell phone, and then all the health officers for all 3 districts, as well as the general website for all 3 districts. And within all of those, there's a contact us link right on the top part of each page, and you can find the phone number for each local office. So again, if you have any questions or concerns over the summer, please give us a holler. So I will get to the questions here. If you have any questions, please put them in the chat. And then at the end, we'll open it up to questions by phone if anyone needs that. All right. So the first question is, with the recent release of Dr. Fauci's emails in which he indicates that masking is ineffective versus COVID-19, will you be advocating for the unmasking of our kids? So I have not read Dr. Fauci's emails. I'm unaware of that. And I've read numerous studies from numerous different people that masking is effective. So I don't have any plan on changing my stance.
Yeah, Dr. Morse.
Yeah.
This is Steve Hall. I will just add that was a FOIA of Dr. Fauci's emails. That was early on in the pandemic before masking was recommended. So masking is still recommended.
Okay, thank you. Yeah, in the beginning, I didn't recommend masking because there was no evidence to support it, but now we have evidence to support it. So thank you, Steve. It's hard to keep up with everything. I think that's the only question in the chat. So if anyone has any other questions, type them in or go ahead and unmute yourself and ask away. And I just want to thank all of you for being such great teammates. The silver lining in this pandemic has been getting to know all of you and work with all of you. It's a group of people that I haven't had an opportunity to work with. So this has really been an honor to work with all of you. So I have a feeling we'll be working together still. I mean, this is not going away. And whatever you need over the summer, just let us know. And I know you know how to get a hold of us or find how to get a hold of us. I'll give it another pause for anyone who might have a question, but otherwise, you know where to find us. All right, guys, have a great summer. Take a break.
Yay. And it's the last one for the year.
Summer school overlap.
Yeah.
Some of that started the 14th. I'm like, I think it starts
No, it starts the 24th.
Sure that we don't.
No, it doesn't. We're done with balance on the 17th.